Good evening, everyone. Hope all is well. So, we are going to be going live right now with a dentist who is going to be speaking about how to look after your teeth and gums, which is going to be absolutely amazing. I've never had a doctor or dentist on my life, so this and we are going to be welcoming Dr. Richard.
Hi, how are you doing?
Good, and yourself?
Great, thank you.
Good stuff. Thank you so much for coming on board, Dr. Richard. It's a pleasure to have you here. You know, I've never had a doctor or a dentist come on my live session, like I said just now, and it's great for someone like yourself to spread that knowledge of how one should look after their teeth, their gums, because the mouth is the place where everything goes in, right?
Yeah,
And
yeah. It's an
it
important area.
it's in my eyes, I think it's the most important area that one should look after because diseases and everything that we see on a daily basis goes through the mouth, the air that we breathe, the food that we eat, the chocolates that we have,
Yeah,
the
definitely. Well, the
the
thing is, with the gums,
yeah,
gum health is very important. So,
absolutely.
when people have bleeding gums, bacteria can get in that through the pathway through the gums, and it can. There's a lot of studies which kind of relate gum health
Of
to
course.
kind of the health of the heart. So it is really important for people to keep their gums healthy.
And this is what we are going to be discussing on this live session, and you're going to be sharing all that knowledge that you have on how one should look after. So, thank you so much for coming on. Before we start, Dr. Richard, if you can
No,
introduce yourself as to who you are. Everyone knows you're a dentist, but what you do and your company, and where are you based in London so that we can take this conversation forward.
yeah, so basically, I'm Dr. Richard Marks. I'm actually born in London, in Hampstead, in the Royal Free Hospital in 1982. My father was a dentist.
Okay.
Yes, I'm 38 now. My father was a dentist, and my mother.
Okay.
They actually met at dental school in
No
London,
way.
UCL. Yeah, they met in London at
Wow.
dental school. My mother, uncle, and father were there. That's where my mother and father met. So, and my father, he was very successful as well, and had his own practices. And I kind of assisted him in the early days and kind of watched him. He was one of my main mentors. I'm the
Sure.
oldest child of 8 children, so
Wow.
yeah, it's a
Wow.
big family.
Wow. So
And
you, I mean, normally kids inherit properties or money, but you inherited the career from both your parents.
Yeah, absolutely. And I think I was always kind of inspired by him. He was always a really hard worker. He used to work long days, long hours. He was just amazing person, very inspiring person.
Absolutely.
And, I guess in some ways I always wanted to be like him. But the other ways I wanted to kind of make this my own,
So
make
did you
it my own.
always, when you were at school and college or I mean, university is the time that you sort of started your career. But when you were young, did you always think that you wanted to be a dentist, or was there something else in the
There,
doctor's
there
field that
were
you
there
wanted?
were other times where I thought about doing other things and thinking, oh, maybe I want to go in a different direction from my parents. My parents, funnily enough, are into real estate as well.
Wow.
Yeah, we have like my family, do have a bunch of property investments, so it's an area that they've been interested in. But obviously their main career is dentistry. Um, so yeah, but I thought about being a lawyer, accountant, different things. Obviously working in
Sure.
tech,
Of
um,
course.
and some of my brothers work in insurance in the city, so they're very mathematical. But I was always more of a people person, and I like kind of doing something, fixing it, something that's wrong, getting the result, and as I said, dealing with people. I'm not squeamish, from doing medical things. So all of these
My
things
father,
suit
my
me.
father, my father used to say, and he still says it, that the dentist and the plumber are are the highest paid uh, careers or jobs because they clean the dirt.
Well, you need them. That's the thing. You need
Absolutely.
them.
You can't
It's
do
a proper need.
you can't move forward in life without
I
having a
know
drain
exactly, and
unblocked and your
sometimes
mouth.
people have toothache, which is really horrible.
Of course.
When you have toothache, it's because it's close to your neural centers, your central nervous system. So having toothache is a really horrible experience.
Of course. I mean,
And
I've
really,
had that, and
really
I've sort of
exactly,
been to a dentist and sort of got that fixed. But Dr.
exactly.
Richard, what I want to get at is get into the nitty-gritty of it. Like, how should one look after? Do you want to start with teeth or do you want to start with gums? What comes first? Gums come
I
first, right?
think, well, obviously they're both linked together. Um, we usually, when we do an examination and assessment, we chart all the teeth and we look at the gums at the same time. So um, I think generally we still recommend like 6 months, at least appointment.
Okay.
Regular cleaning for the gums is really important with the dentist or hygienist. Also, it's really important to have a low sugar intake because that's what causes decay. Very difficult, I know. We all love a bit of sugar, but yeah, and having a low sugar intake because that's about the bacteria feed
Of
from,
course.
and it's much better to keep the sugar intake low because
Of course.
that's one thing. Brushing the teeth twice a day. Electric toothbrushes are really good. That's another thing. People have wondered, do electric toothbrushes really work? Well, yes, now the technology is here that is making them so effective that you really can't achieve the same cleaning with a manual toothbrush. So
Oh, so
the great electric toothbrushes is they
it's best to use an electric toothbrush is what you recommend.
absolutely,
And which one is
absolutely.
the best electric toothbrush to use?
Well, there's two. There's Oral-B. The top one is called the Genius Edition at the moment, Oral-B, or there's like the 8000, 9000 series. And then there's the Philips Sonicare range, of which there's the Diamond Clean. So these are really the best, either the Philips
So
Sonicare or the Oral-B.
so when someone brushes their teeth, and this is a lot of times that we get it, that dentists always recommend that you should brush on your gums than your teeth.
Yes.
Why is
You need
that?
to brush it. Well, basically, you need to brush your gums and your teeth at the same time because basically bacteria gather around the gums and the teeth. So some people clean just the teeth, but then they're missing cleaning the gums. And that causes a lot of problem because then the teeth are okay, but then the gums have problems. So you really have to clean your teeth and your gums. But another really important thing is not to people over scrub, especially when they have a manual toothbrush. They overbrush the gum or the tooth, and they can wear away the gum or the tooth. So the good thing about the electric toothbrush is it often stops when you press too hard, or it's got an alert to let you know if you press too hard. And also, the electric toothbrush does all the work for you. It's either
So you just hold
rotates
it, so you just hold it
or
there and it does all the stuff that you would be doing it with a manual toothbrush.
um, yeah, exactly. So the manual toothbrush, it does everything you need to do. It's got like a rotation that goes round, or it's got a
Okay.
vibration. So
Okay.
you don't really have to do much movement, which is great.
I mean, my cousin is a dentist, and my elder daughter, she also aspires to be a dentist one day. So I hope that she does it.
Wow, great, great.
You
It is
know,
a great profession. You
absolutely,
know, one really good thing about the profession is you really are in charge of what you do, and you can work as much or as little as you want. So that's why it's a really good profession for people who want to be in kind of control of their working hours, because it's up to you to decide how much or little you
absolutely.
work.
And I want to share a humor over here that every time I go to the dentist, I remember Mr. Bean's episode of when he went to the dentist.
Of course.
Every time it comes to my head, you know, when I see that stretcher, it's like,
Well,
man,
the thing
Mr.
is, you know, it is a very funny experience, and also it's something that people have a lot of, they've got lots of fears about, obviously dental phobias, but also everybody knows that experience of sitting in the chair, the mouthwash, you know, the
Of course,
brushing. Everybody knows what a dental experience is like.
of,
So, but I think, you know, now people used to be really worried about dentists, and it used to be a really terrible experience, let's say.
yeah,
And now we're trying to make this experience something that people are not scared of, and that they can, you know, as pleasant as possible. You know, it needs to be
absolutely,
done, but
absolutely. I mean, if you can touch upon, we touched upon of that gums and teeth should be looked after.
yeah,
Some of the best methods that they could be looked after, like I know there's flossing or going to the dentist. I mean, but in your eyes, are there any other methods that one should look how should one look
yeah.
after
Well,
their teeth?
so now there are air and water flossers. There's the air flosser by Philips again, Sonicare. There is the water pick. So there's the air and water flossers, which you can use. They're a machine to floss between the teeth. So the good thing about those is it makes it easy. It's quick, it's effective. If you put mouthwash in those, you're also getting antibacterial action through the gum. So we call it interdental cleaning. Those brushes that go between the teeth, TP
Yes,
brushes
yes,
as
yes,
well.
absolutely.
Mouthwashes are really important. Like a fluoride mouthwash, that will actually strengthen the enamel. If you have sensitive teeth, you know, Sensodyne
As a
is really important.
Sure.
So that will
As
really
a as
help
a
you.
as a as a Sorry. Yep. As a
Yeah, and
Muslim,
then
a lot of these mouthwashes have alcohol in it.
yeah,
So
there are
is there
alcohol-free versions. There are alcohol-free versions. In our clinic, we have the alcohol-free version because not only, obviously, the alcohol from a religious sense of point of view, but also it's not very good for your soft tissues to have alcohol exposed to the soft tissues all the time. So
and
there
which
are
one is your
alcohol-free.
best recommendation
So there's
for
Listerine, there's Listerine
okay,
Total Care, there's Listerine Zero. The one without alcohol is called Listerine Zero, which means zero alcohol. And
okay.
also there's, like, obviously people know for the gums Corsadil. There's a Corsadil versions which don't have, which are
It's
non-alcohol.
got
So
a
there's Corsadil
Corsadil has got a
non-alcohol.
real bad aftertaste. It's got a real bad
It does.
aftertaste.
You
Every time
can
I brush
dilute
with
it.
that,
You can dilute it. You put it, you know, like put part of a cap, you know, 1 cap to 3 caps of water. You can dilute it down. It doesn't have to be as strong. Or there is a daily version. There's a daily version called Corsadil Daily, which is less strong.
of course. And is that as effective as if you were using the concentrated version?
Uh, the thing is, the concentrated version is not actually designed to be used every day continuously because it is so strong. So, you know,
Gotcha.
diluting it can be a good solution, definitely. The other thing is obviously hygienist. Regularly see a hygienist. It's important. Have that ultrasonic cleaning by
Of
the
course.
gum.
How many times in a month or in 6 months should one go and visit the hygienist?
So some people go every 6 monthly, 3 monthly as for people who are smokers or have severe gum problems. Most people is 6 monthly, and then people who have like amazing teeth can actually go once a year. So, you know, And some people have no teeth; they can take their teeth out, and they never have to go.
Of course, of course. I mean, it's weird, right? One's like brushing like this, and one's like brushing like this.
Exactly,
It's
exactly.
crazy. Um,
You
I
know,
want
we
to
want to
touch
keep our
upon,
teeth,
of
obviously.
course, something I want to touch upon also is the diseases that are caused by not looking after your mouth, gums, and teeth.
Yeah.
What are those diseases and how do they affect you and your whole body? If you can
Yeah,
touch upon
so
that.
the main link that's been researched is between periodontal or gum disease and cardiovascular health. So that's heart problems, blood pressure, because it can work its way into the bloodstream and then get through to the vessels to the heart. So that's why it's really important to keep the gums healthy. There are other diseases that are related to periodontal disease, such as diabetes, because that has a real effect on the gums. And then there's also, I mean, smoking, though not a disease, it's important not to smoke for the
Of
gums
course.
as well. That's something that really affects gum health, and the smoke can get in through the soft tissues again, absorb through the palate or absorb through the gums. So, and it stains the teeth as well. So, you know, that's not an ideal thing as well. But generally, if you have kind of healthy gums and a healthy mouth, that is the entryway to your system, your respiratory system, your digestive system. So it is the starting point into your body system. So, you know, people don't always think, because you can't see inside the mouth, people don't always realize how important it is to keep their mouth clean and brush regularly and floss regularly. Because they can't see it. But this is the entry to the full digestive system, the full
Of
respiratory
course.
system. So
Of
it's
course.
really important to keep that clean. Yeah.
And what else something that I wanted to touch upon also is right now we're going through the times of the virus, the COVID.
Of course.
Um, is there a link between the the COVID and not looking after your teeth or mouth? I mean, is there a chance? Are the chances more likely that you may contract this virus because your mouth is not clean, or is it
Yeah,
just
well, scientists have, interestingly enough, scientists have found a link, and there's been a few articles about how mouthwashes can be antibacterial but also antiviral. And basically, coronavirus is a virus. So actually, some mouthwashes can actually reduce the transmission of the virus. So there's been
wow?
some really good research in that. And obviously, it is passed through that mouth and respiratory system, the coughing, you know, those kind of things. That's the main place it's passed. So,
So
you know,
if someone uses a mouthwash, then they don't need to wear a mask.
well, it definitely helps decrease. You should do everything. Wear a mask, wash your hands, use a mouthwash.
And as you mentioned, like Listerine 0% alcohol, does that also cover that part? Like it's antiviral, that it will sort of help you in terms of blocking the chances of you contracting or you
Yeah,
giving the
yeah.
virus
Well,
to someone else.
yeah, I mean, that one is a very good one. There's also like there's one called Peroxyl, which is a peroxide-based one, which is a very good recommended one for these purposes. So that can really help as well. But I think people are worried about coming to the dentist at this
Of course,
point,
this is
but
what my
you
question as
still,
well.
yeah, of course, but you still need to look after your gums and teeth even now, and we don't want to see people's just teeth and gums deteriorate, and but just because of this problem, like we're taking very big precautions here. We've got
What
PPE,
sort
we've
of
got
precautions are you taking in terms of clients coming into your consultation? If you can talk about that
yeah.
as well.
Yeah, so we've had all my staff and myself have been antibody tested. I
Wow.
actually have the antibodies. I have actually had it and have the antibodies and immunity. So we have the full blood testing from our doctors. So all my staff have that and certification for it. We take temperature with a
Okay.
contactless thermometer of each person who comes through the door, which we record, and it just shows whether it's in the right level. It goes green if they're okay, or an amber color if it's just slightly raised, but it will go red if the temperature's too high, and
Of course.
obviously we can then stop.
And during this lockdown period, was your consultation completely open, or did you also have to close down for a
Yeah,
certain period?
we did have to completely close. We actually closed on 24th of March. We were doing a lot of kind of video consultations, and we were having to kind of prescribe painkillers and other methods of managing at home. The dental hospitals, and they have urgent dental care centres, they were doing the treatments instead of us. So it was a really hard time because obviously we couldn't help our patients, we couldn't see patients, but
And business-wise, I'm sure you had a slump as well on that part.
yeah. I mean, we were out of business with basically no revenue for 2.5, coming towards 3 months, which is nearly a
Wow.
quarter, nearly one full financial quarter. So it's a big thing for us. But I'm someone who looks at things over the long term.
Of course.
I kind of like have a 10-year lease in the premises I'm in, and I'm here for the long term. So I think things, you have to ride out these difficult times and things like that. What
Of
can you
course.
do?
And where is your consultation based?
So we have obviously video consultation is one way, by Zoom or by WhatsApp, FaceTime. Our actual premises is based in Marylebone in central London.
Okay.
We're near Regent's Park, Marylebone and Baker Street stations. We are in the Harley Street area of central London. So that's where we're mainly based, where my day-to-day kind of work is, and we have been able to reopen from 8th of June, which
Uh,
was this Monday. So,
And are you doing any sort of deals or packages right now, or you're
well, there's
charging
all
full
sorts of things.
prices?
Our consultations are no charge. So, if somebody wants to have video consultation or come in, there's no charge for the consultation, and we have different treatment options, and we can lay everything out, and then you can see how you want to work things. We have payment plans, and finance, and there's different options, ways you can break it down. You can do a bit of work at a time.
Of
So
course.
there's always a way. If you want to get your teeth done, you can.
So there is no sort of, you can't put yourself away saying that the dentists are not there, because there's everyone there now. It's open and people can go and look after their teeth, their gums, whatever consultations they want. They can come to you for any kind of service.
Exactly. I mean, obviously we started with urgent treatments, and there's been a backlog of things. Patients have been waiting for us to open, messaging us,
Of course.
and everyone couldn't wait for it to open.
Yep.
But now we're here, we got started, and we kind of it's getting rid of the emergency treatment, and then we can get into the more cosmetic things at a later date, I think.
Of course. And as you're based in Harley Street, which is one of the world's best and well-known medical streets in the whole of the UK, do you get clients from all over the world that come up to you, like the Middle East, from the Southeast
Yeah.
Asia, from Asia itself, America? Do you have a variety of clients that come over from all over the world, or do you just particularly look at UK-based clients?
Yeah, what I would say is, being in London and in central London, we have a really kind of ethnically diverse and international client base, especially before lockdown, but even just generally people living in London. So we have like yes, Middle Eastern patients, we have patients, Nigerian patients, we have obviously English patients,
Of
we
course.
have patients from
The
Russia and Azerbaijan and
Wow. So it's all
America.
so you cover the whole of the world basically. People
Yeah,
come up
yeah,
to you.
you really get to meet new people all the time. That's one of the really interesting things about the job, and they bring different experiences from their countries and cultures. And I think one really good thing about London is people are really willing to learn about different cultures, and people are all living together in a big melting pot.
Of
And
course.
we kind of all come together and stand side by side, which I think is a really important thing at this time, because obviously with all this worry about race, is one place where
Yep.
people are really diverse, and they're really supportive of different cultures, and people are really interested to learn about new
Absolutely.
cultures and the foods they eat, what different experiences they have. That's one of the best things about London.
Absolutely. Before I wrap up, here I'm going to ask you two pieces of advice. One is for the kids out there, the kids that love chocolate, the kids that love
I think everyone
sweets.
loves chocolate.
Of course. But as a adult you can stop yourself, whereas a kid can't.
Yeah, of
And
course, of
also
course, of course.
the kids like my daughter, for example, and other kids throughout the world, they have the aspiration, maybe not being a neurosurgeon or a gynecologist, but they always aspire, I want to be a dentist. What is your
Mm.
piece of advice to these children that are out there that can't stop themselves from eating chocolate, but yet they want to become a dentist?
Well, firstly, when it comes to the diet for children, if you like, for instance, fruit juices, we do say they're really good for your health, but obviously they can affect your teeth. So we say through the straw, that's the ideal thing. Drink them through a straw, then it bypasses the teeth.
Okay.
Then, following from that, we recommend that a little bit of chocolate is fine in moderation. Even the scientists have found, and I'm a chocoholic, so I'm going to say this as a dentist, that there's antioxidants in certain forms of chocolate. As we all know, dark chocolate can be good for you.
Of course.
So I'm not against chocolate as a matter of principle. I just think keep it in moderation. It's actually best to have it around mealtime. So if you have one sugar hit altogether, that's better. The worst thing you can do is have a little bit of chocolate throughout the day. Then your teeth never get a chance to recover from it.
Of course.
So,
Of course.
a little bit of different things. Of the other things, of course, are for children, there's other things they can have, a banana, grapes, kids actually love these things,
Of course.
so once you get used to this, even some kids, when they drink water, they actually really enjoy it. But there's squashes with no added sugar. There's different ways that you can, and milk and oat milk and almond milk. There's different things you can do for your child to give them a good, healthy diet. But I
Of
would
course.
say, don't say to your child you can never have chocolate, because that's just unrealistic. And then they're probably going to go around the corner and buy
Of
it.
course, it always happens. And the other part of the
And
question was
yeah, for
advice
them, in
to,
terms of yeah, in terms of kids who are aspiring to be a dentist, yeah, I think obviously it's a profession that I really enjoy. But what I would say, the best thing to do is get some work experience. You approach, a local dentist, or maybe someone who's a family friend or a family dentist. Ask them, maybe you can observe for a day, or some period, and see exactly what they do. There's nothing better than being able to see it.
of course,
Sometimes they'll let you help out with certain areas of administration, things like that. And if you see it in person, you'll really know, is that a job that I want to do? On the plus side, we really help people. We can get people out of pain. We can change their smile. But on the difficult side, if you don't really like looking in people's mouth, one, I wouldn't do it, because that's a basic part of the job. And if you're not someone who is really into the medical, there are gums, there is bleeding, there's teeth, they need cleaning out. So if you're not into that, then I wouldn't do it. And I'd say for someone that you can, another interesting thing is you can go on to own your own practice, and you can obviously make a business side of it. Yeah, you can go and work in hospital. There's different things you can do within the
Of course.
profession.
Of course.
Um, Obviously, it's cosmetics. You can do orthodontics, straightening teeth. You can do, as we said, periodontal gum health. You can do implants. So there's lots of different things you can do. But
Within the dentist industry, that's so vast. I mean, all I thought about dentists was gums and teeth, you know. But now you're opening up
yeah,
so many other
yeah.
avenues
I
that
would
people
say,
can.
yeah, one thing I would say is for a dentist, like it's really important to put healthcare and the patient first. Like obviously money in business is important, but when you're a dentist, the patient's health and doing what's right comes first. So, you know, if it's something that you want to do, if you really want to help people fix things,
Of course.
that's the way to look at it. If you enjoy that, then you'll
Go ahead
definitely
and
enjoy
do it.
it.
Absolutely. Dr. Richard, before I wrap up, you know, I do this with all my guests that come on my live sessions. Is one part of it is sharing knowledge, the other part of it is sharing some positive advice. There's a lot of negativity that's around us right now with COVID, with the lockdown, with the social distancing. Also, the fact now racism is a big
Of
factor
course.
right now. There's a hell lot of negativity with people losing their jobs, people on furloughs, businesses going bust, people contracting all sort of diseases like the coronavirus, like cancer, all that kind of stuff. There's a lot of negativity around us. I would like for you to share some positive advice that they can take on board and feel that there is life outside of the negative vibes that are around us.
Yeah, so what I would say is, you know, obviously it is a difficult time now, and I really feel for people who are struggling and going through difficulty. I think, you know, life is an interesting journey. It's not necessarily a smooth path. I think everybody in life experiences difficulties and hardships and difficult times. Um, you know, death of a loved one, or illness, or financial hardships, and many different things. And obviously, the race issue I think of in a separate way. But
Yep, yep,
I think when firstly, I think sometimes the way these struggles can kind of really build us as people, and the way you react towards things. And also, I think that usually round the corner from something bad is something good. You know, they say from these difficult times come great things. From
absolutely,
something bad comes something great. So I
absolutely.
think, you know, a lot of the time when it seems like now everything is clouded, it's a dark time, we around the corner, you know, you keep going. Life is a marathon, not a sprint, as I like
Absolutely,
to say. And
absolutely,
it's a climbing, you know, and
absolutely,
you want to climb that mountain. You know, when you get through those different levels, that's when you get a sense of achievement. You know, I think
Abs-
nothing good came from the easy ride. You know, great things come from great struggles. And
absolutely.
I think my opinion is that in terms of the race issue, you know, I'm someone who really believes there's 7 billion people on the planet. We're all one human race, you know, and I think that the more we look together at the bigger issues, that like the environment, world hunger, as one race of people, because we're one human race, the sooner
Absolutely.
we can actually, you know, reach solutions. So what I'm looking for is for, you know, world leaders to sit together around one table and say, how can we solve these environmental issues? How can we address world hunger? How can we address these health issues? How can we address these problems for people of color and racism as one people? Because if we
Absolutely.
keep on destroying
We're,
the
you
planet,
know, like,
we're in a bad point, you
absolutely.
know.
Like someone
We're
great
all on
said,
one planet. We're sharing the same planet, you know,
absolutely. I mean,
and
like someone great said that we're all made by the same sand.
Absolutely.
It's
So
just
when you divide yourself from someone else, I'm different from you. We're all on the planet together, and how someone does in this country will eventually, like with the virus, it spreads globally. We're all in it
absolutely,
together. So I
absolutely,
think it's really important for all people and all world leaders to really think, how can we live better on this planet together
of
and have a
course,
brighter future, and especially for our children. And we want to create a better, that's
of
what
course,
the aim is.
of course. Dr. Richard, thank you so much for joining me today on this live
You,
session. I know you're busy then,
great to speak to you.
consultations and everything's running around. Um,
We got work to do.
if uh, I want to take this opportunity to pitch some business to you. If you're looking for a property, PTH.
Of course, thank you, absolutely,
But thank you so
absolutely.
much for
Yeah,
tuning in, and it's been a pleasure speaking to you. And good to know, really, really good to know about how one should look after their teeth and their gums so that they don't contract diseases like cancer, diabetes, heart attacks, strokes, all that kind of stuff. It's been an absolute pleasure knowing all this from yourself. So thank you so much.
great to speak to you. Great to speak to
Absolutely.
you.
Thank you, Dr. Richard. Take care.
Thank you. Bye. Bye.
Bye-bye. Bye. So, guys, that was Dr. Richard Marcus, who is a dentist based in Harley Street. If you're looking for a consultation or to get your mouth sorted, get in touch with Dr. Richard, and I'm sure he'll be able to help you out. That's my live sessions done for today. Tune in tomorrow where I've got more people coming into my live sessions. Actually, I'm pretty excited about the live session that I'm going to have tomorrow with a guy who is a seven-figure seller on Amazon. So do tune in. Thank you so much to Dr. Richard for sharing all that knowledge and positivity that he did, and all the viewers that tuned in today. It's been a pleasure to have you on. Stay safe, look after your teeth, and take care and enjoy your evening. Bye bye.